I want you to imagine that you have been diagnosed with a rare form of cancer that is poorly understood and that has limited treatment options. That is the reality that many patients with pancreatic neuroendocrine tumors must face. These tumors are difficult to diagnose, they're often detected late, and they're very difficult to treat. Therapies like radiation, surgery, and chemotherapy do exist, but they're often limited. They don't help all patients, they're often very aggressive, and they lead to lifelong complications for survivors. As a result, every 1 of 2 patients diagnosed with these tumors will not survive beyond 5 years. In addition, the number of patients diagnosed around the world is increasing worldwide. It is clear we need better therapies for patients and families, but to do so, we need to first understand what's happening inside these tumors. DNA is the recipe book of life. It's found in every single cell, and it tells cells how to function and survive. Like any good chef, cells need to know what recipes to read and at specific times. And to do so, they use proteins called histones. Histones attach to the DNA and they bookmark DNA. They serve as bookmarks, telling the cell which recipes to ignore and which recipes to read. This is very important because when cells read the wrong recipes at the wrong time, they don't function normally, and that can lead to cancer. My research thesis work has discovered a unique protein pair called CDK5P25 that disrupts this system. It misplaces DNA bookmarks in the book. And in the pancreas specifically, this misplacement of the bookmarks transforms these cells from normal pancreatic cells to pancreatic neuroendocrine tumors. At its core, our research has established that CDK5P25 is an important driver for these cancers. And now that we know this, we have an intervention. My work is currently focused on developing new therapies for CDK5P25. I am doing so in 2 ways. First, I'm collaborating with the College of Pharmacy to screen 10,000 compounds that are currently FDA approved and used in clinic. If any of these compounds inhibit our protein pair, they can be applied to the clinic much faster. In addition, I am working with partners in France and the United States to develop new compounds that are specific to CDK5P25 and have less side effects. Finally, because we know that these tumors have CDK5P25 inside of them, we can biopsy patient tumors, identify this protein pair, and better direct therapy. I hope that my research one day allows me to grab a patient's hand, tell them their cancer is not misunderstood, and we have effective therapies. Thank you.